Hello, and welcome to our listeners around the world. You're listening to the monthly podcast presented by JAMA Health Forum. I'm Dr. John Ayanian, the director of the Institute for Healthcare Policy and Innovation at the University of Michigan and the editor of JAMA Health Forum.
And I'm Dr. Melinda Buntin, Bloomberg Distinguished Professor of Health Policy and Economics at Johns Hopkins University and the deputy editor of JAMA Health Forum. JAMA Health Forum is a peer-reviewed, open-access online journal focused on health policy, healthcare systems, and population health, and one of 12 specialty journals in the JAMA network. Our podcast each month presents highlights of new content from the journal, including timely interviews with authors of research studies and commentaries. Follow us on jamahealthforum.com, on Apple Podcasts, or wherever you get your multimedia, and on jamanetworkaudio.com.
Our guest author today is Dr. Jamie Tam. She is an assistant professor in the Department of Health Policy and Management at the Yale School of Public Health. Her research focuses on evaluating and understanding the impact of tobacco regulations on tobacco use disparities, particularly for those with behavioral health conditions. She is the lead author of a new study in JAMA Health Forum titled U.S. Tobacco 21 Policies and Potential Mortality Reductions by State, with colleagues from Yale University, the University of Michigan, the University of North Carolina, Georgetown University, the Preventing Tobacco Addiction Foundation, and the British Columbia Cancer Center. Welcome, Jamie.
Thank you so much for having me. I'm very grateful for the opportunity to share our work and to be part of your podcast.
Thanks, Jamie. Our pleasure to have you to discuss this important study. For listeners who may not be familiar with Tobacco 21 policies, what are these policies and how have they developed at the state and federal levels over the past 20 years?
Yeah, so for most of the 20th century, the minimum age of tobacco purchase was 18. And there's a handful of states where the minimum age of tobacco purchase was 19. But the Tobacco 21 movement and Tobacco 21 policies were policies that would raise the minimum legal age of tobacco purchase up to 21, aligned with alcohol purchasing as well. So what are these policies? They raise the legal purchase age for 21, which makes it more difficult for young people to access and purchase tobacco products, right? And how these policies have really developed, we kind of need to start at the local level because Tobacco 21 policies and the entirety of the Tobacco 21 movement started at the local level. And localities and states really paved the way forward for the rest of the country. So Needham, Massachusetts was the first city in the country to prohibit tobacco sales to people under 21. And this was all the way back in 2005. And then at the state level, it wasn't until 2014 when Hawaii became the first state to implement Tobacco 21. And this was followed by California in 2016. But at the local level, cities and towns, especially in Massachusetts and New York, were really the policy pioneers here. They were the folks who were moving forward with Tobacco 21 laws, even without much of an evidence base surrounding their effectiveness, but really motivated by the idea that this was a common sense public health policy. And it made so much progress in some states, and especially in those two states, that by the time New York and Massachusetts had implemented a state-level Tobacco 21 policy, more than half of their state populations were already covered by local-level Tobacco 21 laws at the county and the township levels. And over 540 localities across the country had Tobacco 21 laws. 42 states and Washington, D.C. have their own Tobacco 21 laws in place. There are still 8 states that don't have their own Tobacco 21 laws in place, but a federal Tobacco 21 law was signed in December of 2019. So that's the sort of short version of the history of Tobacco 21 laws in the country.
Thanks for that history, Jamie. Can you tell us what new research question your study in JAMA Health Forum was designed to address? And also briefly tell us about your data sources and methods.
Yeah. So we wanted to estimate potential reductions to premature smoking attributable mortality that are associated with these Tobacco 21 policies. The last time this was done was in 2015, before we had very much evidence to go off of, and before we had as much information as we do now about the real-world rollout of Tobacco 21 policies. So we now use quasi-experimental evidence that shows that Tobacco 21 laws decrease smoking among young people. And we translated that evidence into policy effects that we use in simulation models of smoking. And we have separate simulation models for each of the 50 states and Washington, D.C. in terms of our data sources, I think the real thing that we're trying to bring into this study is the sort of detailed state-specific histories that I think is often lacking from analyses of these types of policies at the national level. So we use detailed historical data on smoking patterns and mortality that are specific to each of the states, because we know that there are major disparities in not only smoking patterns, but also mortality and life expectancy by state. And this geographic heterogeneity is something we wanted to make sure that our models could reflect. We also use, and this is, I think, where the real world stuff matters, we also use very detailed historical information about Tobacco 21 policies as they were implemented and the date that they were implemented at the local and state level. So the idea here is to reflect the real world rollout of Tobacco 21 policies. And what we do is we take our models for each of these 50 states and we simulate Tobacco 21 policies for each of the state populations from 2005, when Needham, Massachusetts was the first locality with a Tobacco 21 policy, all the way to 2100. And the reason why we have this long time trajectory is because it takes decades before changes in smoking initiation among young people is translated into reductions in mortality risk. And we ran these Tobacco 21 policies under 3 types of policy scenarios. The first is looking only at local level Tobacco 21 policies. So ignoring state Tobacco 21, ignoring federal level, so local level only. Then we looked at state and local Tobacco 21 policies. And then the third policy was our combined scenario that includes local, state, and federal Tobacco 21 policies. So you can think of this last scenario, the one that includes the federal Tobacco 21 policy, as our most optimistic policy scenario, because that assumes that as soon as the federal T21 law was signed in December 2019, it immediately went into effect, which isn't normally how this sort of stuff works out. But that's our most optimistic policy condition. And then our more conservative policy scenario evaluates state and local Tobacco 21 policies based on experts' understanding that Tobacco 21 compliance is higher at the local and state levels. So the true impact of the US Tobacco 21 movement is probably somewhere between these two scenarios, considering the sort of delays between a policy being signed at the federal level and it actually being implemented.
Thanks, Jamie. That's a helpful summary of your study design and the scenarios that you were comparing. What were the key findings of your study?
So across the country, our models estimate that local level Tobacco 21 policies are associated with 55,000 premature deaths averted, or 1.5 million life years gained. So local level policies were major contributors to premature mortality reductions in states that had extensive local level policy coverage. One example of a state with lots of local level policy coverage is Massachusetts. Roughly 70% of the state population was already covered by Tobacco 21 policies at the local and county level before the state Tobacco 21 law went into effect. But other states with extensive local policy coverage were not just Massachusetts, but New York, Illinois, and Minnesota. Now, if we look at both state-level Tobacco 21 policies and local Tobacco 21 policies, we estimate roughly 442,000 premature deaths averted and 11.3 million life years gained. And then the other scenario we looked at was the federal law. Now, if the federal Tobacco 21 law had been immediately enforced when it was signed in December of 2019, we estimate that this would be associated with an additional 84,000 premature deaths averted. So combined across local, state, and federal Tobacco 21 policies, comprehensive enforcement of Tobacco 21 is associated with up to 526,000 premature deaths averted and 13.3 million life years gained through the year 2100.
Did any of your findings surprise you in terms of that variation among the states? For example, I was somewhat surprised that California, with such a much larger population than Kentucky, only had a moderately greater number of deaths averted, and it was a fairly sizable number for a state with a smaller population like Kentucky. Can you shed light on that for our listeners?
Yeah, and this is where that state level information is so important, right? California, yes, it's the largest state in terms of population size. And yes, they were an early adopter of Tobacco 21. But California also has very low smoking rates compared to other states. And California has longer life expectancies compared to other states. So for a state that is as healthy as California, there's less room for improvement, which means that when you implement a new policy like Tobacco 21, yes, there will be public health gains and we should celebrate them. But it's really the states with shorter life expectancies, the states with higher smoking rates, and the states that have very poor tobacco control environments. Those are the states where the most can be gained in terms of public health. So you brought up a great example. Ohio has a third of the population of California's, right? California's population is much larger than Ohio. But because Ohio has higher mortality, higher smoking rates, Ohio actually would stand to benefit the most in terms of the absolute number of premature deaths averted. And that's why we felt it was important to include that state level information.
That's great. So, Jamie, what are the implications of your study for policymakers, people in public health, and clinical professionals?
The first thing I'll say is that for policymakers, being ahead of the curve can really pay dividends for your constituents for generations to come. We really have to give credit where it's due. Like public health advocates and clinicians and these grassroots efforts made Tobacco 21 a reality. These were the people who are working on the ground to implement local level Tobacco 21 laws before anyone else had done so, right? So we have to kind of give them credit. The second thing that I think we should try to understand from this study is there's an assumption that once a federal law is signed, all the work is done. The federal Tobacco 21 law signed in 2019, but the final rule for federal T21 was only issued this year, 2024. So 5 years later. And states have had a very generous grace period. So there have been no penalties for retail violations of the federal Tobacco 21 laws, and penalties won't be issued until 2025. That's one thing to take into consideration. The other thing is that, not all Tobacco 21 policies are created equal. So this is one limitation of our study, right? But one thing to remember is that right now, penalties for lax enforcement of Tobacco 21 are pretty minimal. They're often limited to warning letters or small fines for retailers. And there are other people who are not scientists, but advocates, folks on the ground, who are evaluating the strengths of those policies and looking at the strength of enforcement of those policies. And I think those kinds of details matter. The third thing I'll say is that federal law does not necessarily translate into changes at the state level, but federal law can motivate states to pass their own Tobacco 21 laws, right? So even if the federal law was signed in 2019, we had all these states that followed that example and then implemented their own state level Tobacco 21 laws. And those state level Tobacco 21 laws are the ones that are often better enforced. So right now, there are 8 states without state-level Tobacco 21 laws. And so what that means is that Tobacco 21's benefits to those states hinge only on enforcement of federal law. So these are the sort of policy implications, I think, of our finding. What we're doing, our study quantifies the potential public health benefits of Tobacco 21 laws, but it also makes the case for improving their enforcement. So there's still work to be done here.
Thanks, Jamie. At the end of our podcast interviews, we like to ask a couple broader questions of our guest authors. The first is, what's the best advice you've been given about your career, particularly for developing policy-relevant work, such as your article in JAMA Health Forum?
Thank you for asking that. It seems a little bit like 2 questions, right? What's the best advice you've been given about your career? And then how do you make your work policy relevant? And I will say that something I've learned through experience and also advice that I've received is that policy expertise doesn't have to come from fellow scientists. The other piece of advice I'd like to share that I've received is to make your work as accessible as possible. And by that, I mean, talk about it in plain language that policy folks can understand. So one thing that we've put a great deal of effort into is something that we call the Tobacco Control Policy Tool. It's an online interactive website that we've developed that allows anyone to explore the findings from our models. So to really enhance the accessibility of our findings, we're also re-releasing the Tobacco Control Policy Tool at tobaccopolicyeffects.org. And that allows anyone in the public to explore the effects of Tobacco 21 in their state. And I think this is important, especially for simulation modeling research, which can feel very inaccessible to the public. So the more we can do to allow the public, to allow public health decision makers and advocates to interact with the findings of our study, the more helpful it can be.
And what is the biggest change you expect over the next 5 years related to tobacco policy?
I think expect is really hard, but I will instead offer my hopes, right? What I hope to see is the federal government and FDA moving forward with a menthol ban and making real moves towards a reduced nicotine cigarette policy. So reducing the level of nicotine in cigarettes could be a massively game-changing policy that would dramatically reduce smoking and really kind of move us towards an end game for tobacco use in the country. There's one more issue I'll bring up, and I'm bringing this up because this is, I think, a problem that not many people understand. Right now, a lot of the FDA's activities on tobacco regulation are entirely funded by cigarette manufacturers. What that means is that e-cigarette companies are not contributing any user fees to help the FDA do its job to regulate e-cigarettes. And that's something that Congress needs to do. So Congress needs to move forward with legislation that basically forces e-cigarette companies to pay their share so that we can properly fund the FDA to regulate not only cigarettes and cigars, but also e-cigarettes.
I'm Dr. John Ayanian, along with Dr. Melinda Buntin, and we've been speaking with our guest author, Dr. Jamie Tam, of the Yale University School of Public Health, about how Tobacco 21 policies could reduce smoking-related mortality over the next 75 years. You can find a link to the article in this episode's description. The episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.